Dive right in. Okay, so if you have been following my collaborations this year, a lot of them have been art-based. This one is not art-based. This one is very personal for myself and for Rebecca here. This is about my daughter Olivia and her sort of birth story. I'm going to throw it to Rebecca. She can tell you a little bit of background about herself and why we are talking to her about a birth story.
Hi, I'm so excited to be here. My name is Rebecca Moretto. I'm a certified nurse midwife practicing in North Carolina. I've practiced in a variety of birth settings, home hospital and birth centers, done clinic work, and I have the experience of walking with families through situations such as Amy's in collaboration with my physician colleagues. But as a midwife, I really get to experience a lot of the heart issues that come along with these kind of situations, the emotional roller coaster that can be pregnancy in general, and especially higher risk pregnancies. So I am excited to speak to some of this.
If you don't know much about how Olivia was born, that's what we're going to talk about here. But just the very difficult pregnancy we had and how we're still dealing. Like Olivia is almost 2 years old now, but it's still a daily struggle. I guess we'll just start at the beginning. Pedro and I got married in September of 2018. Got pregnant in November of 2018. And we hadn't, obviously I'd never been in a relationship where pregnancy was a option. I was 35. I kind of wasn't super clear on like how fertile I was anyway. Like that's not a thing that, at least in my circles, that like we sort of talked about or took the time to like go find out. It was very easy for us to get pregnant, which I know it's a struggle for a lot of folks. So that part wasn't the hard part of the pregnancy. So I found out I was pregnant when I was around 6 weeks, and we had the blood test just to like fully make sure at 6 weeks. And then 7 weeks later, we went in and we found out we were a multiple birth. So there were 2 heartbeats. And at that point, I don't know if one heartbeat was stronger than the other. I don't know if you can really tell that in a sonogram at that age, but what we could see was that they each had their own placenta. And what is exactly is that called?
That's called di twins, so dichorionic diamniotic twins. So they have their own, from what it sounds like they have their own amniotic sac and their own placenta.
In medical terms, we were told that was like the best possible situation. So can you elaborate on why that's the best?
Yeah, so there just seems to be less complications with di twins. There's something called twin to twin transfusion syndrome that seems to be a little bit happen less in those kind of situations. They have more of an opportunity to grow at the same pace, to receive the same amount of nutrients. And so we just see less complications, more later gestations, more time that they're able to be in the womb.
So outside of that, how often do you find that twins happen naturally? Because at the same time I was pregnant with twins, I knew 4 other couples that were pregnant with twins. And I think I know for sure that 3 of them were because there was some intervention. A lot of eggs were fertilized at one time and then like implanted.
The risk of twins goes up with things like fertility treatments. If somebody's undergoing, which I know this is not your situation, but if somebody's undergoing IVF, fertility treatments, taking medications to help with their fertility, there is a higher rate of twin pregnancy, but then also with age. So after 35, there seems to be a higher rate of twin pregnancy.
And I had read that, like when we found out we were having twins, because there's no history of twins in my family other than Pedro's mom, or my husband's mom was pregnant with twins, but lost both of them before Pedro was born. But I don't know how much that side of the family, like.
So that could have played a little bit of a role, and then age. So it's like 3% of all live births in the United States are twin pregnancies of every kind. The dizygotic twins that like you had are the majority of those cases. And then for women over 35 or people who are becoming pregnant, birthing persons, it's like 1/3 increase with that age increase.
And is that like some sort of evolutionary, like you're getting old, so we're gonna give you a chance at having more kids in
That
the
seems to be just like the theory behind that.
okay.
Yeah.
That's
It doesn't seem to affect the outcomes. So being older doesn't seem to impact the outcomes of the twin pregnancy, but it just seems that the older birthing persons are, that the higher risk there is of a twin pregnancy.
okay. And you're I noticed a couple times you've called it a risk of a twin pregnancy
And
instead.
yeah, and I'm trying to stop myself from doing that. That's the medical term. And it's and I think that that's a really good point to point out, because I try to keep myself from that language, actually, because obviously for the people experiencing the twin pregnancy, it's not a risk. It doesn't feel like a bad thing. It's just, I think in obstetrics there is so much language that's steeped in patriarchy and fear and all of that, that we label things like that, like complications that may not be seen as bad things or complications to the people experiencing them. So I appreciate
Well,
you pointing that out.
I appreciate that perspective though, because I think based on the response Pedro and I got when we told everybody we were having twins, it was like the best thing that had ever happened in my life.
Right.
And
Right.
but it was scary, and it was,
Yeah.
I think my initial reaction was, oh my God, how am I going to do this? Like,
Sure.
I was prepped for, I'm still prepping for one kid. I mean, I feel like I had about 10-15 minutes of like, oh no.
Yeah.
And then it became the like, well, I'll never have to get pregnant again. Our goal was
Yeah.
2 kids. I'll knock it out. Maybe the pregnancy is going to be a little bit more difficult just because all the risks, obviously that come along with having two in there. But yeah, I feel like I felt the risk factor of having two in there, but everyone around me was just like, oh my
Yeah.
God.
Yeah.
But yeah, it's always a bit different for the person who's like doing the carrying.
Right.
So yeah, we went ahead and started doing the like buying two of everything. We bought two, or like a twin crib that was like connected but had a separator. We bought a 2 baby stroller, like, buying two of everything.
Yeah.
And I actually, my husband's boss has twin boys. So I went to, I mean, she was the most, I'm also in Ecuador, right? So like I can't
Right.
really have a lot of like in-depth conversations with all my other friends who are pregnant with twins because they're in the States. And I mean, this was pre-pandemic. So like video conferencing, like we're doing right now, was just,
Yeah. Yeah.
it was not in my wheelhouse.
Right.
As it clearly has become now. So I talked to this one woman who had twins, and she gave me these tips that like I couldn't find on the web or in books or anything. My mom mailed me a book about having twins. I didn't get around to reading because we found
Yeah.
out 5 weeks later something happens. But before I get to that, being the person carrying twins came with certain feelings and things. But like medically, how different is being pregnant with twins versus being pregnant with a single? Just because you've talked about when you have clients who find out they're pregnant with twins, you send them to somebody else.
Yes. So it becomes, and again, we go back to this language, right? So it becomes what's considered a high risk pregnancy, and that's outside the scope of nurse midwives, unless they're working in collaboration. But typically twin pregnancies are under the purview of OBs and maternal fetal medicine specialists, depending on the level of complication that particular pregnancy has. And as we've already talked about, there's this question of, are they dichorionic? Are they monochorionic? Are they, does it seem like one is growing faster than the other? is the person carrying them experiencing any kind of blood pressure issues? Or so that kind of the monitoring really does depend on there are standards for antenatal testing and monitoring, but then there can be certain pregnancies that require even more than the standard, just if certain complications arise. So they might have to start, depending on the twins, they may have to start monitoring something called Doppler flow. So just making sure that circulation is appropriate
Mhm.
in utero. If the person carrying them starts to develop blood pressure issues, they may or may not have to be treated for that, but then also maybe getting like lab work on a regular basis. There's growth ultrasounds that need to happen to make sure that at regular intervals to make sure that they're growing appropriately. In early pregnancy, people who are carrying twins it is more common for them to have more intense nausea and vomiting of pregnancy.
Mhm.
And so that's how some folks figure out that they are having twins. They're having this really intense, or hyperemesis is what it's called. It's just like
Uh-huh.
you cannot stop vomiting. A lot of people have to get admitted to the hospital for fluids, and
Right.
it's pretty terrible. So, um, yeah, so so speaking as somebody who might interact with people before they find out and maybe immediately afterward, and then maybe seeing people for postpartum care back at the clinic, depending on if they're sticking with the practice that they got transferred to or not. It can be like an elation like you experience, like this is so amazing, and then it can feel really overwhelming when that journey is laid out, as far as like these are all the appointments that you're going to have to start going to, and these are all the risks, and you need to be looking out for this, and if this happens then this, and you kind of get filled up with it's almost like twice the stuff that you're like you were talking about, like how do I prepare for the actual beings, and then also it feels like twice the time commitment sometimes to people of how many appointments that they have to have.
Right. And yeah, when I look back on, like, I'm in the middle of trying to get all my records from all the pregnancy stuff, but I did have high blood pressure, but I think that they equated it to, I think I have the, what's it called? White lab
Yeah,
coat blood pressure,
yep,
where like you just walk in a doctor's office and your blood pressure.
yep, and it just shoots up. Yeah, yeah,
Because that's most of it. Because I did have to monitor my blood pressure like at home a few times,
mhm,
and everything was normal at home.
yeah,
I did have I was overweight when I got pregnant. I was around 200 pounds when I got pregnant. I feel like most of my life has been between like 170, 200. So
yeah,
and then, obviously you're pregnant, you put on more weight, but that was a constant. Every time I went in was like, what are you eating? What are you eating? And it's like,
yeah,
I'm eating what I can
conversation.
keep down. That's what it
Right,
is.
right.
I know being overweight can hinder you from getting pregnant to begin with, but then when you are pregnant and overweight, I don't know how that factors into all the other things. And I know that's not something I prepped you on, but
No, I mean it's a great question, because like you were saying, this is the weight that you have always been. And I think there's a growing body of research and a movement, the health at every size movement, trying to figure out what is actually the weight issue, and what is a health issue. Because so often I think that we've used this pretty arbitrary BMI standard as associated with certain complications, and think we're starting to discover that certain people are a certain weight, and that's the weight that they are healthfully, no matter what they do, and that there are lifestyle factors outside of weight that may predispose us to certain issues. So I think that's an interesting conversation. And in prenatal care, we are taught that BMI has you at higher risk for a higher BMI or obesity, as in over a certain level places somebody at higher risk of gestational diabetes or preeclampsia. And I think in the future, we're going to discover what actual lifestyle factors, what genetic factors, and how much the epigenetics that are created in our society and different communities has a role to play in all of that.
I had a hard pregnancy, but getting the like weight comments in the middle of all that was just so frustrating, especially when, I mean, and there are absolutely some valid concerns, right? Like I had to do the gestational diabetes tests a couple times, but
You
Olivia,
had to do the 3 hour
yeah,
the 1 hour and then the 3 hour. Yeah.
yeah. And I can't tell you how many times I got blood drawn. I lost count and I faint at the site, or not
It's
at the
so
site.
hard.
I can get like shots and stuff, but when blood comes out, I faint.
Yeah.
So every time I had to go get blood drawn, it was okay, we got to go find her a bed. And it was all this like, I feel like one of my biggest fears in life was being a burden to people. And now
Right.
all of a sudden, me and my child felt like I was a burden on people. So that was
Really
but
sorry you felt that way.
eventually I got to the point where I'm like, I'm pregnant.
Yeah.
Get out of my way.
Yeah. Yeah.
Yeah, which I think that was pretty freeing once I felt that.
I do want to point out, Amy, I think that that's a really good point that you're making, because I find that I've had several folks tell me that they've stayed away from care, and we're learning this through research that we know that people actually stay away from routine care because of a fear of having that weight conversation.
Yeah.
And it keeps people from being their most healthful selves, ironically. So
Yeah.
I'm really glad that you brought that up.
Yeah, I mean it's not even within pregnancy, but like I knew someone once who was in medical school and he posted something on Facebook that where like being fat was like the punchline of the joke. And I messaged him and I was like,
But really?
you need to rethink being a doctor if you think being fat is a punchline, because you are going to drive people away from your practice. And if you really care about people, you want them to keep coming in and seeing you so that you can make them better.
Sure.
And my mom has, she's dealt with a lot of weight issues. She's gone to doctors who they won't listen to her, because all they want to talk about is, oh, this is how you need to deal with your weight. And she was like, but no, I'm here for something else. Can we focus on that? So yeah,
Right. And you missed the point.
yeah,
You
I
missed
think
the actual
somebody's
issue.
weight is, it's the most external visible thing. And it's just unfortunate that some doctors just go straight to like, you need to lose weight, and that's it. That's the end of the appointment.
There is additional testing that comes with that. So you may have, I don't know if you had to do the gestational diabetes screen since you were in a different country, but here is kind of standard practice if somebody has a BMI over a certain level to have an early 1 hour glucose screen. And if that's normal, then they have to repeat that 1 hour glucose again around 28 weeks and start that process again. So I'm not sure if you had to do that. And then there's a different level of ultrasound as well, that it's kind of an automatic targeted anatomy that is once somebody has over a certain BMI, in addition to the extra testing for twins. Well, I mean, it all goes together, but just to make the point that even in a singleton pregnancy, there is extra antenatal testing for that.
Right. I do remember taking a few glucose tests, because there's something else, like when they take your blood, they can measure glucose, and then there was something else that they measured at the same time.
Probably your complete blood count, looking for things like anemia, infection.
And they did at one point send me to, I was just going to like the sort of general medicine clinic. That's where my OBGYN had her office. But she did start sending us to prenatal specific office in the city of Quito. And that's where we had the majority of our ultrasounds. And I feel like I was going like every 2 weeks. So we found out we were having twins at 13 weeks. We went through the like, oh my God, what are we gonna do, to, oh my God, people love this. I felt special times 2, because it's still pretty rare. So 4 or 5 weeks later, we went in for the gender reveal sonogram. Like we didn't do a big gender reveal anything, but like just to find out, because I knew they were girls. I knew they were girls, because every time I saw a little girl, I would weep. When I saw little boys, I was like, annoying. which they're not. Boys are lovely. But I knew they were girls. So we went in for this gender reveal. We were told they were girls, or we were told like 99% it's a girl, but there could be a leg in a weird position that's like covering,
Right.
At least one of them, they said they're a girl. I see the vagina. And so Pedro's mom was there with us. We figured, why not? It's her grandbabies. And I got my mom on the phone just to do the celebratory, oh my God, it's boys or girls or one of each or whatever. And so I was talking to my mom on the phone. Pedro was I was on the bed, all bare and had all the gunk all over my belly and stuff. I had my mom on the phone. Pedro's mom was off in the corner, and the technician who was looking around in there got real quiet. And because they were searching for the second heartbeat. And I believe the week before we had not like a visual sonogram, but just I got something wrapped around me and they were just searching for the heartbeats, like that kind of a sonogram. And the second heartbeat was really hard to find. And my OBGYN just, I think, attributed that they were moving around a lot.
Yeah. Yeah.
Pretty common.
Mm-hmm.
So that's what the week before, there was still 2 heartbeats. One was just really hard to find. But this day.
So the week before wasn't an ultrasound. It was a non-stress test.
Yeah, something like that.
Just with the monitors, no ultrasound.
Yeah, no visuals. Okay. Yeah. This technician couldn't find the second heartbeat. So he ran out to go get my OBGYN. It felt like forever, right? But they came back in. I still had my mom on the phone. My OBGYN came back in. She was looking at the screen. And mind you, all of this is happening in Spanish, which I'm not fluent in, but you can tell.
Yeah, you can feel. Yeah.
So I had the force. I was like, Mom, I'm going to call you back because I don't know what's happening right now and I need to focus. My OBGYN was looking at everything, and no disrespect to her, but she, in English at least, she looked at Pedro and said, we lost one. That's it. That's all I got. And I mean, Pedro's mom is sitting over there. Pedro's in there. At one point, everybody left besides Pedro's mom to go. I don't know where they went. And I'm hysterical and also in pain. At this point, I'm like 18 weeks pregnant. So like, they're not huge, but I'm, it's still uncomfortable.
Sure.
And Pedro's mom, so Monica, her name's Monica. Her and I are just in the room by ourselves, and I'm crying. And I think Pedro had told her to just like not engage. But at one point, I asked her to come over so I could hold her hand. And then people came back in. And all I really remember is Pedro coming back in, and then he asked everybody to leave. And he's trying to console me the best he can, but I just remember screaming at the top of my lungs, I'm never going to get over this. And I probably won't ever, but so that's how that happened. And it took me a while. Like they let me stay in that room for a good 20 minutes, just like crying. And I came out because I think they had finished up. In between all the crying, I believe somebody came back in and like cleaned my belly up and stuff so that I could sit up. And I remember coming out of that room, and when you came out of that room in like the radiology department, then there was just like the waiting room. So it felt like I walked out of the room and then every head like turned towards me. And I just, what I felt like I needed to do was just find a place to sit so that I could call my mom to tell her what had happened so that she could relay that to everybody and I didn't have to talk about it anymore.
Right.
And like my whole life, like I've been in therapy for like most of my life, started in college, all when I was living in Philly until I moved to Quito. But so like, I knew how to sit with my feelings and like, and my entire life, I just wanted to sit with those feelings. No, it didn't matter what feeling it was. If I was depressed or sad or angry, like I just wanted to like feel those feelings. This was the first time in my life that I needed something else to think about because I didn't want to think about the kid I lost. And I've even had people say in my life, like, you should rephrase it. Like you didn't lose her. I still don't know how to phrase it. After being told that the twins were in the best situation possible and then losing one of them, I just felt like maybe I didn't know the risks fully. Like they didn't tell me the risks fully. And I just felt a little bit deceived and a little bit, I don't know. I felt like it was something I did, which obviously it's not. But I think that's still going to be, I'm going to blame myself for the rest of my life. So I didn't know if since you don't deal with pregnancies or multiple pregnancies, but if you had a sense of how often does this happen? Like how often do you lose one or both?
So I can just answer that question quickly, and then I want to go back to some of the other things that you said. So for dichorionic twins, it's around in the United States around 3% that one is lost, and the risk of what is termed like fetal death and prematurity and complications from extreme prematurity are certainly higher in twin pregnancies, regardless of the type of twin pregnancy it is. Those risks are higher if they're sharing a placenta, or especially if they're sharing a placenta and a sac. Those risks are even higher. But it is interesting to me and striking that just speaking to that moment where you were just told she's lost, and lost where, and I often sit with people in that statement of loss, and I think people really do struggle with that word. I'm sure in that moment she did feel lost to you, because she was there and so much still there, and you're being told that she's not, and that's a cognitive dissonance that I think unless you've gone through it, you can't understand it. And I'm sad for you that that space wasn't held for you to enter into that extreme grief safely. So I'm glad that you had some space with just Pedro and just Monica. But I think that having a solid person who knows what's going on to sit there and hold your hand and be able to talk you through that moment really does make an impact on how you view yourself moving forward. Because the fact that you are blaming yourself, that's a really common reaction. And I validate that feeling for you, but it does make me feel upset, I guess is the word, on your behalf, because certainly from an objective perspective and an outsider's perspective, it's absolutely not your fault. This is a known complication of twin pregnancy. This happens, is not an uncommon thing to happen in twin pregnancies. It doesn't make it less meaningful, but it does. I think that there should be a normalization of that. And I think it's hard to hold both things, to know that there's these complications associated with a twin pregnancy, and to also be able to go through that pregnancy as much as possible in joy and celebration without feeling constantly anxious and fearful. I think it's really difficult to do. And I think it has a lot to do with how things are presented to a person and how information is presented. And I think in your case, you had the added factor of not only being in a highly medicalized situation by necessity, but also being in a highly medicalized situation that you didn't have, that wasn't your primary language.
Yeah. And I think I put a lot of pressure on Pedro to translate every single thing. Cause I needed to know. And I did have this, after we found out we lost her. So her name was Elisa, Olivia and Elisa. And we'll talk about this in a later thing, but like, I listened to, so there's a guy I found on the internet who was like Olivia in this situation. He had a twin in utero. His brother died in utero, but he's 50 years old and he still says, I have a brother. So I'm still trying to figure out, like, how do I think I need to figure out how I want to talk about Elisa myself and then relay that to everybody else. Like, and then eventually when Olivia's old enough, like how she wants to talk about Elisa, because maybe she doesn't want to say, I have a sister. Maybe that, maybe that is too painful. I don't know, but we'll see.
But I think it's true that it does depend on the person, and that person should be able to steer that ship of language and meaning, whoever went through it.
Yeah, because I think Pedro and I will have a perspective as parents, but as the sister, I have no idea how she's going to feel about it. I guess going back to Olivia, for the rest of the pregnancy, I was just terrified. So, so from 18 weeks to 38, because that's when we had the C-section. So for 20 weeks, for 5 months, I was terrified that I was going to lose Olivia. And that really, obviously, for the rest of, I was not happy. The rest of the I had moments. And I think once we passed, 30, whatever that threshold is where they can survive outside of the womb, what is that, like 25 weeks? Then I could sigh of relief a little bit, but I still didn't. I wanted her in there for as long as possible, but I also wanted to not be pregnant anymore. The intensity of not wanting to be pregnant anymore was so deep. I can't even articulate it.
Did your body feel like an unsafe place for her to be?
Yeah. There was even at one point, I forget at what week I was, but at the time we were living in a 2-story house. I was coming down the stairs a little too fast. I tripped and fell. And I only fell down 3 stairs or something, but, and I can't recall right now because it happened so fast, but I'm pretty sure my arms came out and my stomach was not hit, but I legit stayed on the floor. I rolled onto my back and I just stayed on the floor and cried because I was like, oh my God, did I just kill her?
Right.
I didn't. She was fine. Pedro even asked her, do you want to go to the ER right now? And I was like, no, I'm pretty sure I broke my fall and I didn't fall on my stomach. So yeah, little things like that. And the food I consumed, because there's so many foods you can't, when you're pregnant, I became really vigilant about that. But I also couldn't keep down a lot of stuff. I had really, the first trimester was terrible. I vomited a lot. And then I had the 3rd trimester
resurgence.
That came back. Heartburn the entire time was a huge, heartburn for 9 months. And a lot of trouble sleeping, especially when she got big enough to kick. She was active in there. And I do think I found moments of joy, especially when I could see her moving around in there, and I think that sent a signal to my brain that she's fine. She's big enough that you can see her kicks. She's strong enough that you can see her kicks. She's fine. So I think my pregnancy got a little bit better once I saw the evidence of how strong she was in there.
Right.
So one of the things that I had to do once we knew we lost Elisa was keep her in there, which was a really odd. She wasn't, I think at that point she was the size of a peach pit or something. I mean, she wasn't that, but because, Olivia was now, we can't do anything to interrupt her or risk her or whatever. So Elisa just gotta stay in there until Olivia is ready to come out, or the C-section was scheduled. So I wondered, what effect does that have on the surviving twin or the mom, that there's now a child in there that is deceased?
So again, much lower risk for the type of twin pregnancy that you had for there to be issues. There is a higher risk of certain bleeding disorders in both the person carrying the pregnancy and the baby. And I think if they were sharing a placenta, those risks go up substantially. But in the type of pregnancy that you were experiencing, that those risks are much lower. Like you're saying, really the recommendation in the type of situation that you had is just to keep on trucking. And that feels, I don't, it really does feel like you're asking someone to just live in a trauma every day and also be functioning to support another life.
Mhm.
That feels like, I don't think that there's enough attention given to how much that is to bear on a daily basis. So, I think that there's more of an issue if, like, I think that the recommendation, like you experienced, is just to keep going to term unless there is something else that develops. So really close monitoring of both the person carrying the pregnancy and the surviving baby, just of like things like preeclampsia or bleeding disorders. And then the plan for birth would change based on any development of any issues.
Yeah, I
Yeah.
think our plan was usually, I think the plan was always C-section, just because with twins, giving natural birth comes with its own risks. I know there's risks in both natural and
Yeah.
C-section.
Sorry, I should also say that the other risk would be infection. So monitoring for signs and symptoms of infection would be the other reason to go ahead and have a baby.
Yeah, it felt really weird. I was carrying a growing child and a deceased child for 5 months, and I didn't have anywhere to go. I didn't know anybody who had experienced that. I knew people who had lost both, and then the pregnancy was just over. But I still, in a time where I wanted to like beat myself up, not physically, but like I wanted to punish myself
Sure.
for losing Elisa. But and that meant for me, that meant like I'm gonna eat a whole cake today, something like that. But I couldn't because Olivia still needed me to do all the right things. And just for everybody watching, like Olivia was born perfect. I've had talks with like my mom, my aunt who lost a child. I think her daughter only lived for a matter of hours after she was born. And my aunt had a son afterwards who made it. He's in his 20s now, but he had a heart transplant when he was younger. He had cancer soon after that, all that stuff. But my aunt told me that the daughter she lost, she feels like is her son's guardian angel, keeping him alive through all this like crazy stuff. And I don't generally, I'm not religious. I don't really have like a place in mind where people go when they pass. But the thing that helps me, and I tell myself that like Elisa dying is the reason Olivia came out so strong. Obviously my body wasn't going to support both of them, or didn't support both of them. But
Yeah, can I just say that's not necessarily the case?
okay.
Again, it's an impossible situation because there's no way to know. It doesn't sound like and this doesn't always yield something, but sometimes there's like a pathology done on the deceased baby, and there can be some answers there on the placenta or something. A lot of times there are no answers for that. I think it's one of the tragic parts of taking care of people who are going through pregnancies when these kind of things happen, that often we don't have an answer. And so then the default answer is that the person carrying that pregnancy, it was their fault somehow or their body's fault somehow.
Yeah.
Instead of like unknown, it is actually like a known normal variant of this type of pregnancy.
Mm-hmm. Yeah, and you talk about the pathology being done on the child that didn't make it, and that I believe at some point they asked me what we wanted to do with Elisa, and at the time I felt like all I could do was focus on Olivia. Like, she's my first child. I have no idea how I'm gonna be as a mom or how much she's gonna
Sure.
need me. Like, obviously I wanted to do like not obviously, but like I wanted to try the breastfeeding because that was
Mm-hmm.
really shoved down my throat. Um, we'll talk about that more, but that didn't really.
Mm-hmm.
My answer to whoever asked me about what we wanted to do with Elisa was just take her out. Like, and I guess I wasn't presented with options either. It was just like, what do you want to do with her? And I was like, I don't know. I don't know if I would do anything different. I mean, maybe you can talk about what the options are, but we didn't have any tests done. I think I let the hospital have her. Yeah, I for the most part, I don't know. I don't know what happened to her. We didn't get any tests done on the placenta or anything because I felt like in that moment I just needed to focus on the kid that they were going to send me home with. And
Right.
like, how in the world do you take care of a baby?
So much of this just goes back to how something is presented and the kind of counseling that occurs around it. So I think, like you said, you're overjoyed. You're meeting Olivia for the first time. You're in, outside. You've known her for so long, and now you get to actually see her face, and you're trying to do your best for her. And then people are asking you questions to which you have no answers. And I think that's a space for a pause and like, hey, congratulations. This is amazing. We have to have some really hard conversations. When is a good time to come back and have those?
Right.
And then allow you to prepare your brain space for such a conversation, and then present you with all the options and the rationale behind them, and then let you make a decision so that it feels like, not that you didn't have any say in what happened, but it's almost like, I don't feel like that's informed consent to ask somebody when their abdomen is open and they're meeting their other baby what they want to do with their other baby that has a lot of trauma around it, and they don't have a lot of medical knowledge, and there's no options or reasons presented about that.
Yeah.
That's not informed consent about anything.
Yeah. I will say my sister-in-law, who is a doctor, she was allowed to be in the room with me. And I think I actually put a lot on her to like make decisions for me.
Sure.
Because of the language barrier, plus like she knew what was happening, and like
Yeah.
I needed to, once that epidural went in, I could have been anywhere.
Yeah. Yeah.
So I did ask her to make some decisions, if she felt like I wasn't in the mental space to do so. I don't think she made any decisions as far as Elisa went, but
Yeah, I mean, I think you would have had to have signed some forms, and there's probably stuff that you've blacked out that is probably fine to be tucked away.
I will say we did have, so we went to like parenting prep classes, and that's where we met another couple through IVF, was pregnant with twins as well. And we had a doula there who was instructor during that prep class. I feel like she wasn't really part of the day at the hospital when Olivia was born. But I feel like if I had asked her and paid her to be there that day, like she would have been the person who sort of gave me space and guided me through some things. But I guess we figured, we're giving birth at like one of the best hospitals in the city. My sister-in-law, who is a very respected doctor, is there. Like, maybe we didn't need the doula there, but yeah, I think in retrospect, maybe she would have been the person that could guide me through the like all the emotions of the thing, rather than, because my sister-in-law is great, but like she was there for the medical stuff,
Right. And that's not to say that you would have even made any different decisions. It's just more having that space to make them is important. And you didn't know. And I think that's a failure of the medical system, not a failure on your part, to not communicate that to folks. It's like, yeah, we're here for this procedure and we're going to keep you safe. And also, I mean, I honestly, in an ideal world, somebody like that doula would be employed, or maybe not employed, but like somehow that communication would be seamless so that everybody would have access to a medical advocate who would be able to give them that room around situations like that. And I think it becomes problematic sometimes when there's pros and cons to be had for doulas being employed by facilities, because then there can be some bias there. But yeah, I'm just, again, and the reason I keep going back to this is just because the things I'm hearing you say about yourself, which again, valid, I understand why you're thinking them, but I think so much of it is created in that moment, in those moments immediately after something happens, where there is this little window of time where you can get through to somebody before their brain starts laying down a framework around an experience to be like, this was not your fault, this is why this happened, before their brain starts making this cage that is so hard to break out of about their self-concept and the meaning that something had for them as a human being.
Yeah. I feel like, yeah, I've gotten a lot of it. It's not your fault, but yeah, after the fact, after I've already,
Right.
like you said, put that framework in there.
Yeah, because of course, because who else's fault could it be?
Yeah.
I mean, I do that now with my kids. Something happens to them that has absolutely nothing to do with me, and I'm just assuming it's me. I could have just not even been there or been in town, and it's my fault.
Yeah.
So, yeah. So
thank you for walking me through some of that, and just, it's honestly, it's just good. It's good to have somebody hear it, you know.
Yeah.
I feel like I haven't even really had this deep of a conversation like with my mom or sister or anything about it, but they get the overall gist. But
Yeah.
But thank you. Yeah, I wanted to talk to a medical professional about it, and we're going to have a part 2 of this where we talk a little bit more about once the baby's here.
I wanted to make sure you got to talk about, though, about the, like, what do you even call Elisa coming out?
Oh,
Do you
right.
want to talk about that at the next one? Because I think that's important.
Yeah.
And that might be a little much for today, because I also want to honor the fact that this is a lot for you emotionally to put out.
I think the next one, I would love to talk a little bit more about breastfeeding and then raising Olivia while honoring Elisa. Again, it's nice to, I go through stints of like not talking about it at all. And then I'll have some nights where I just wake up crying, and I wake Pedro up and we talk about it a little bit. It's nice to have, like, I planned this call. It wasn't
Okay.
like wake up crying and want to talk about it.
Yeah, that kind of comes at you from nowhere.
It'll keep coming, I'm sure.
Well, I just really feel like it's a gift that you are sharing this with me. Truly excited that you're doing this for people, because I've not seen a good resource for this kind of situation.
Great. Yeah. That is my hope, that somebody who was pregnant and lost it. And again, I keep saying lost it.
No, there's also not great language around that either. There's not a great, I mean, it's an important discussion.
Yeah. Maybe that can be, if we get one of your friends to join us, maybe we can have like a 10-minute, just like, what can we say instead of lost? Because that's not serving anybody well, and it's not even accurate.
No. Well, because again, that goes back to that blame thing, right? It's like I lost my kid in the grocery store.
Yeah. Like it was my fault. I wasn't paying attention.
Yeah.
I lost them, but this is
right.
that.
This is not that. Yeah.
All right.
Well, I'm giving you a big hug from North Carolina.
I miss North Carolina so much. Hopefully we'll be able to visit soon.